So let's talk about toothbrushes then. When is it time? We have the electronic toothbrush that I bought, from you directly for your recommendation. And then, my husband still uses the handheld. So and I just actually looked at his the other day. I'm like, Dr. Perry would not be happy with the way this toothbrush looks. So I threw it in the garbage, put a new one in because I had just come to see you. So the one that you gave me, I put in his little receptacle. And he came in, what happened to my toothbrush? I'm like, it is time for a new toothbrush. So looking at a toothbrush, can we tell by looking at it, or should we go by a calendar to replace the head on the electric one, or to replace the handheld?
That's a good question because it's going to depend on its use and, how hard you're brushing and the nature of the mouth and there's a lot of factors. But I would say, you should be able to look at it and see if the bristles are bent. I know some companies have indicator bristles that have, like, some of the bristles are colored blue. I think.
Yeah.
And if that's more than half gone, like the color is gone.
Oh, that's smart.
And that'll indicate it's time to replace it.
Yeah. Okay. Yeah. That's great.
Yeah.
So going back to this, what I've learned from you over the years, so we've talked about floss, toothbrush. Let's talk about toothpaste, because there are, you go to any toothpaste aisle in any grocery store,
right,
and there have to be 200 or more different types of toothpaste, with fluoride, without fluoride, whitening, sensitive, on and on and on and on.
Yep.
So what is a smart way to choose your toothpaste?
Okay, so teeth are made out of a compound called hydroxyapatite. So that's the buzzword right now with toothpaste.
Hydroxyapatite?
Hydroxyapatite describes calcium phosphate. So calcium phosphate in a very organized crystalline structure, and they call it hydroxyapatite. It defines the combination of calcium and phosphate. This is the glass that your teeth are made out of. So
our teeth are made of glass.
A type of glass. Glass describes, like, for instance, the glass on your car window, or at a window, a clear window would be silica.
Right. Okay.
Right?
Yes.
So they just melt sand to create silica. And so silica molecules are organized so well that they're clear. So enamel, if you were to extract enamel, it would actually be translucent.
Wow.
Just like a window. But that's only the first, or the outside 1.5 millimeters. Sometimes on back teeth, it can be 2 millimeters, maybe even 2.5 at the cusp tip. So enamel can be fairly thick, and in a microscope.
On our molars?
Yeah.
Okay.
On the front teeth, it's thinner, and it's made of hydroxyapatite, the outer surface, the enamel.
Okay.
I call it the chocolate layer, because I describe teeth like M&Ms.
Yes, right.
That's dentin, which is different. Okay. That's similar to a bone, but it's a little bit different than bone.
Is this a peanut M&M where the peanut is the bone?
Well, the peanut would be the blood vessel, I would say.
Okay.
Yeah.
Can we pause there and talk about M&Ms for a second, and then get back to the toothpaste?
You bet.
So, because I love this, this is one of the many ways that you have helped me learn things, is by your excellent metaphors. You use metaphors brilliantly to help, like, the non-dental mind understand what's going on in the mouth. So, and M&Ms was one of those. So, yes, please continue on the M&Ms. And what color M&Ms are we using here today for the metaphor?
There's always some excellent teacher that I've learned from. Jeff Gray from the Coy Center helped me use the M&M analogy. I got to give credit to him.
Okay, yeah, that's good.
But yeah, what I say for people that have erosion, or like a piece, maybe their gum has receded above, like their teeth used to be wearing a turtleneck, and now they're wearing a V-neck sweater, right?
Yes.
That's the long in the tooth thing. Like the whole phrase "long in the tooth" doesn't mean the teeth have gotten longer, but the gums have become shorter.
I have some V-necks in my mouth, unfortunately. Yeah,
exactly.
It's sad.
So now the teeth are cold, right? They're like shivering because they're exposed. They got the V-neck. They want a turtleneck.
Yes.
Right. Especially when they go to Switzerland, they're like, "Wow, I need a turtleneck now," right? Yeah, so I tell people that the chocolate is showing.
Mm-hmm. Oh, the chocolate is showing because the enamel on the outside of the M&M
exactly
is gone.
Well, the enamel ends, and then above the
Yes.
enamel is the chocolate layer.
Right.
Or on lower teeth, you would say, like below the enamel,
yes,
the chocolate would be showing.
Right, the chocolate is showing, yes.
Most of the erosion, they used to call it abfraction, and recently it changed to non-carious cervical lesion.
Oh my gosh, that's a big word.
Right.
Yeah.
Thank
I like
you
M&Ms.
to whoever changed that. Right. But it's those little notches on, usually people notice them on the upper side teeth. Mm-hmm. And
I feel them.
Yep,
I feel
so
it.
that's called, that's like the chocolate showing right there of your tooth. So that can become sensitive. And if it's symptomatic, like if it's sensitive, then there's options. It can be sealed or covered.
Oh, it can? Really?
Yep.
Okay. So let's get back to toothpaste, and then I want to go to that because I want to learn more about the erosion.
Now, the toothpaste can actually help with those areas.
Oh, it can?
Yeah, you can treat those in a natural way with toothpaste by remineralizing that chocolate layer.
All right. What toothpaste would help do that, and how to use the toothpaste? Because there's something about, I remember that you said about rinsing after we brush our teeth versus not.
I think the most important thing is that we don't rinse.
We don't rinse. See, this was news to me, and it's such a habit to rinse out the toothpaste out of my mouth.
Yeah, and most people don't learn what to do after they brush their teeth, right? They just see their older brother or their older sister do it, and they think that that's the way you should do it. But they haven't had a really in-depth discussion about it. And everyone has different challenges. I would say that it's okay to rinse after brushing if you don't have problems with cavities.
Okay.
But if you have tooth sensitivity or cavities, kind of like...
Or recession,
that's a spectrum, and everyone's somewhere on that spectrum, then not rinsing with water after you just want that hydroxyapatite in the toothpaste to soak into the teeth.
Okay. So when we're looking for a toothpaste, especially those of us who are on the spectrum, then we need to look for that ingredient on the label?
Well, I think that, how like some types of magnesium supplements, magnesium citrate, magnesium glycinate,
right,
or different amino acids are formulated differently.
Yes.
So some of them are more effective than others for certain things. Yeah. So sometimes a toothpaste won't say hydroxyapatite, but its formulation is wonderful. It's great. It works. Toothpaste companies, or like on the label, will say hydroxyapatite now because it's become something that they are looking for that word.
Right. Okay. So, now I am looking for that word.
Just because you don't see hydroxyapatite doesn't mean it's a bad toothpaste. That's kind of what I'm trying to say.
How do we find out, though, if it's not on the label and we happen to like a certain, let's say I'm a Colgate person. I mean, I don't use Colgate, but let's just say that I love the taste of Colgate. I've always used this particular, but it doesn't say hydroxyapatite. How do I find out?
I would say it's probably fine. What I would do is take your Colgate that you love and then look it up on the RDA value. And you can just Google it.
Yeah.
RDA, it stands for relative dental abrasiveness.
Oh, interesting.
So that's like how abrasive, or like what's the sandpaper grit? What's your grit level of your toothpaste?
Okay. And what's the range for the RDA?
So it could be from zero. Oil, for instance, oil and water are zero. There's no abrasiveness.
Okay. Yes.
Right?
And you say had actually suggested brushing with olive oil.
You can do that if you'd like, but you won't have the benefit of calcium and phosphate.
Oh,
you won't be able to remineralize.
I see.
Okay.
Got it.
Now, RDA values above 200 are usually the whitening toothpaste. And those, I think most people should avoid that.
Okay. Why?
Whitening toothpaste works by basically sanding your tooth with sandpaper.
Oh, wow.
But more like polish. Right? So instead of using
fine
fine sandpaper, but it can get fairly coarse. And everyone's had I shouldn't say everyone, but some people have had the experience of brushing with toothpaste, whitening toothpaste especially. And all the companies have whitening toothpaste. You can find all the brands have whitening toothpaste. But the one thing that you will find, the pattern is that it's crunchy. It's really crunchy. It's unpleasant to keep that in your mouth. So that I think that we've kind of raised up a whole generation of rinsers now because they're like trying to rinse off all that crunch that they got from their
Raising
toothpaste.
rinsers. That's an alliteration for you.
Exactly, right. But I think that there's some truth there.
Yes, right. And it makes sense because everyone wants white teeth. Now, the few times that I've tried whitening my teeth with a whitening toothpaste, I get what's called, and you told me about this as well, sloughing. So I don't use whitening toothpaste because of that. So can you explain what is sloughing?
Well, I'm not sure if we've got really good research about sloughing because there's so many other factors. Some people that have tissue type, like I use the analogy of fruit. So orange skin, an orange peel is very tough, right? Pomegranate even more. But some skin is very delicate, like a peach, right? Or a strawberry, very delicate skin. And there's also it's like a bell curve. Different people have different skin types.
In their gums, in their mouths.
Yep, exactly.
Yeah.
Some have really delicate peach skin.
I see.
And
Fascinating.
some have really thick orange peel, skin.
Wow.
So if you've got a delicate skin type, you might be damaging your gums with not so much the toothbrush, although the toothbrush bristle is important. It's not quite as important as the abrasiveness of the toothpaste. Because of a study from Australia, a wonderful study showing the repetitive brushing motion on extracted teeth, teeth that have been basically mounted in a lab, and then they've got robots that are brushing day and night.
Wow.
And then they've got numerous types of brush tips, soft, firm, medium, and then they have numerous abrasiveness. And what they discovered that a toothbrush, maybe a medium or a firm bristle, not the soft, without any abrasiveness, like maybe oil or something that's very mild, like baking soda, for example, would not do any damage long term. Okay, but once you introduce the abrasiveness, like these whitening toothpaste, now you're starting to polish a little too much, and you're taking tiny little layers off over time. So this is a very important. It's an important point that if you're doing this twice a day for 20 years, you could really start to see an impact later on.
Like your teeth turn gray?
No,
like,
I would say
would
like the chocolate
like?
layer, the abfraction.
Oh.
The edges of the abrasiveness at the
gum line.
Yep, right at the gum line. Yeah.
So you wouldn't see necessarily any change on the surface of the tooth?
Right.
It's at the gum line.
Well, I mean, enamel's very, very strong. It's like stone.
Oh, okay.
It's similar to glass. So it's not going to show the wear like you would see dramatic changes at the gum line where the edge of the enamel stops, and then you have the margin where it starts to the softer layer. We call it the chocolate layer because we're using the M&M analogy here.
Yes.
So the chocolate layer is very susceptible to those abrasive toothpastes, which whitening toothpaste is one of them.
So if you are using a whitening toothpaste and it has a high RDA level, 200 above, then you would just use a whitening toothpaste in short periods of time. Go back to a toothpaste with a low RDA that's softer on your gums, and then maybe you could do it for another, 2-3 weeks at a time?
Yeah, I mean, if you want to make your teeth have that squeaky clean, or like maybe you're going out on Friday night, you can use that whitening toothpaste to have an immediate effect, but over long term, probably not a good idea to do it over and over again.
Okay.
As your primary toothpaste.
Yes. Okay. That's gold advice for people.
I think so.
So what's the deal with fluoride? There's a lot of, we hear all kinds of things in the news. Fluoride in the water, no fluoride in the water, fluoride in the toothpaste. So what do you suggest? Yeah,
the fluoride debate is so full of misunderstandings, right? So I would say that the first misunderstanding is this concept that we can take a pill or swallow something to have any effect whatsoever downstream. Like people do this, they'll tell me that they just need to take some calcium pills to help their teeth, right? Mm-hmm. Or if you've got an ailment, you take a pill, but not understanding how the process works. So with fluoride, the teeth are formed, and there's lots of variations here, but generally speaking, the enamel is done by very young age. Oh. I would say you should think of maybe 5, 6, 7-year-old, something like that.
You mean how much enamel we have now in our mouth at any age is basically fixed at the age of 5 or 6?
It's been formed.
Wow.
Mm-hmm. Yep.
No more enamel for you, basically.
Correct.
Okay.
Yeah. So the only impact of fluoride in the drinking water that's being swallowed would have to be ingested before that age.
I see.
So you can't drink fluoride as an adult and have any effect on your teeth whatsoever because it just doesn't get to where it needs to go.
Fluoride in the water is for children, young children.
Mm-hmm. Yeah.
That's when it's important.
Correct. Yep. And there is a toxic level of fluoride. So generally speaking, 1 part per million is considered safe. Now we don't have fluoride in our drinking water. Okay? We don't add it to our drinking water. We don't control it, in that way in the city water. But some areas have dangerous levels of fluoride, in their drinking level. And some areas, for example, mountains in Colorado, like if you dig a well, you're going to get water that's high level of fluoride, okay, at a super high level. And there's research showing that children that are in high levels of fluoride have lower IQ tests with children that have 0 fluoride in their drinking water.
Oh my,
And so because of those studies, those research studies that are considered good studies, there's a fear that of fluoride, just eliminate fluoride whatsoever.
Right.
Right?
Yes.
And I can see that. I can totally understand that. And so therefore, we don't have fluoride. I don't believe that drinking fluoride or swallowing fluoride is a good idea. However, fluoride does work really well topically in certain cases. It is very effective because what it does, and I'm generalizing here, but just for the sake of illustration, introducing fluoride to hydroxyapatite helps the hydroxyapatite bond to the surface. Oh. So it's like the salt in the salad.
Yes, right.
It just makes it makes it work. Just makes it work. You're right?
Yeah, I get it.
Similar to lithium batteries, do not have high levels of lithium, just enough to make the whole thing work. It makes the cake work.
Yeah, right.
So that's why 0 fluoride in your toothpaste, and you don't know why you have so many cavities. See what I mean?
Yes.
Like it can work topically really well. So in some cases, it will work, but I think you should weigh that against other concerns. So I think we need to be careful on the dose and the duration, especially with children. But also, there's other factors that I would first try and eliminate rinsing toothpaste.
Stop rinsing.
Stop rinsing is something easy we can all do.
And use a toothpaste in general with a low RDA or low grit value.
Right.
Yeah.
Yeah, and mostly you do that because of a person's ability to keep that tooth. I mean, it's a little bit more pleasant to have low abrasiveness. Most people don't like the crunchy because it feels like sand.
It does feel like sand. Yeah, I'm remembering back to those times when I had a toothpaste like that. Yeah, it's very unpleasant.
Most people want to rinse that out.
Who likes eating sand? Nobody.
Right, exactly.
Yeah.
I mean, the first reaction to like having sand in your mouth is to rinse that stuff out. Right?
Yeah, exactly. Now, when I come in and have my cleanings done, I always pay a little bit extra to have that fluoride treatment that you provide. That tastes great, by the way. And so tell me about that. Like, how does that help me?
Fluoride combines with calcium phosphate, hydroxyapatite to help remineralize your teeth. In your case, you're concerned about the edge, by the gum line, and that would be really good for that. It also would be good for reducing the sensitivity, cold sensitivity, and that's because of the calcification, the remineralization.
Is there a way to do that more often? Because I only get that done twice a year when I'm here. Is there a way to get that topical fluoride if I'm not a dentist and do that once a month? Or
if your fluoride level in your toothpaste is adequate and safe, I would say that you could. What's more important is the multiple exposures to toothpaste.
Okay.
So if you're concerned about cavities or sensitivity, and you can, brush on the toothpaste, rinse or spit the extra. Don't rinse. Don't swallow it, but don't eat or drink after that.
For how long?
Probably 20 minutes.
20 minutes. Okay.
But if you can do 5 minutes, that's fine.
Okay. All right.
And if you can, if it can be the last thing you do before going to bed, that's great. But just try to not eat or drink for a while. And that's just similar. This is kind of like, do you remember, I don't know if it's like a lollipop TV ad. This is a long time ago. Where like how many licks does it take to get to the bottom?
Center of a something.
Exactly. Or right, exactly. It's probably similar to like
Tootsie Roll.
Right, Tootsie Roll. Yeah. Or is it Tootsie Roll?
Or maybe it's not Tootsie. Tootsie Pop.
Tootsie Pop. Is it Tootsie Pop? Yeah. And then I think it was an owl that was like licking on the right. And no one could go more than like a few licks.
Yeah, that's right. Yeah, somebody holds a Guinness World Record, I think, for that.
Right. So really?
Licking
That's
it down.
fine.
Yeah, actually know her. I know her.
Oh, really?
She was, I think, 12 when she wrote Tootsie Pop. Her name is Nancy Jutton. She lives in Bellingham. And she said, I licked all the way down to the center of a Tootsie Pop. She counted how many licks, sent it in to the president, and got this big certificate that they framed.
Wow.
Put up in her bedroom.
That's amazing.
I know.
That's incredible. I love that. I love that. That's incredible. I want to meet her.
Yes.
That's great. I'm so proud. Yeah.
Oh, so we talked about flossing, toothpick, gum health, toothpaste, toothbrushes.
Yep.
Mouthwash.
One concept I want to say before we go into mouthwash is think of your toothpaste like you think of lotion or leave-in conditioner, like say, for instance, hair conditioner, right?
Yeah.
Let's say your hair is really dry and you think you need to use conditioner for your hair, right? You would not put the conditioner on and then immediately shampoo conditioner off or rinse it off. Maybe you would leave it on.
Yeah, right. My hairdresser always does that.
Or lotion for your hand. You would not wash your hands and then put on lotion and then immediately rinse your hands.
Yes.
Right? You would leave it on.
Yes.
Toothpaste is lotion. It's not soap.
Oh, man.
It's kind of like both soap and lotion, but I think we should see it as more like lotion.
Yeah, see, there you go with the great metaphors again. That is so easy to understand, and I totally get it.
If you're concerned about if you have sensitivity, cold sensitivity, that's an easy thing to do with the toothpaste you already have. Okay, you don't have to have a special toothpaste. You can do as long as your toothpaste has adequate hydroxyapatite, and it can remineralize your teeth just by leaving it on for 5 minutes, or not eating or drinking for like 20 minutes, and then it would be like, how long do you have to leave on the leave-in conditioner? Like as long as you can, right?
Yeah.
Just whatever is a reasonable time.
Yeah.
And mouth rinse, on the topic of mouth rinse, if you need to use mouth rinse, usually it's a contact killer. So it's going to kill bacteria. And so I would rinse before you brush.
Well, okay.
Yep. Or you could put a little bit of mouth rinse in a water pick.
Yes.
You don't need the whole thing. You don't need to be spraying mouth rinse. Just a capful, just a little bloop into the tank. And we can talk about like types and what we like to recommend, but all you need to do is put a little bit of mouth rinse. You want to avoid some flavoring agents that can like gum up the system. And I can talk, like one good one is Closest, that without the flavoring agent, and I could talk to you about it. I could share a link for that.
Yeah, that's interesting because I've never used a water pick, and I mean, well, staying on the topic of mouth rinse first, because so number one, if you're going to use a mouth rinse, use it before you use your toothpaste, because you should not, because you need to leave your toothpaste in, because it's like lotion. Don't rinse it out of your mouth. Right. And then what about those mouth rinses with alcohol in them?
Okay, so the problem with alcohol is it will dry your tissues. It just dries your skin. And I think that's why we've avoided alcohol. However, some mouth rinses have chemicals that, that were even worse.
Yes, yeah.
Cool.
So we were talking about mouthwash and that some mouthwashes have alcohol. Actually, I think quite a few of them have alcohol in them. And then you were saying that some mouthwashes have chemicals that are even worse than alcohol on your teeth. Alcohol dries out your gums and your tissues. So what are those other chemicals that we should avoid in a mouthwash?
Okay, so alcohol, it has been used for many years because it's easy to produce. It's cheap, right? Some other things that we use that will kill bacteria. Another analogy here, because I love analogies.
Yes.
But you've got a pool or a jacuzzi, and you want to shock the pool or clean the pool, right? So we use sometimes bleach or chlorine, bromine, which I don't know any mouth rinses that have bromine. There is some chlorine that is safe and effective. The other ones could be like peroxide type in the mouth rinse.
Really?
Yeah, and really what you're trying to do is kill bacteria.
Peroxide is okay?
Well, I would not recommend rinsing with peroxide.
Okay.
Hydrogen peroxide at any level, I don't know. I can't speak intelligently about like what level of peroxide mouth rinse would be safe. I would definitely dilute it a lot.
Because there are toothpastes with peroxide in it.
Right. So peroxide comes in usually 5%. So some people do a lot of damage with like rinsing with like 50-50, peroxide rinses. You can get ulcers from that, or like you can you basically burn the tissues in your mouth, the sensitive tissues like your cheeks. Or
and get the sloughing.
Right, exactly. Or your palate. And you end up with an ulcer because then it irritates the skin, and then your body has like a cellular reaction to that.
Wow.
So I don't recommend peroxide. I think we should be careful with that. But alcohol is just one way to kill bacteria, or like basically take care of the pool, or take care of the garden. You just want to kill the weeds and encourage healthy bacteria. So there's some probiotic mouth rinses that are great. But you're probably not going to move the needle very much. I would tell the probiotic mouth rinses just like, don't flatter yourself, because your bacteria has already been established. It's like the new kid in school, It's a new kid in high school, you know what I mean? And right,
doesn't have any friends yet.
Right, exactly. And all of the, you're a new kid, senior in high school, so.
And you have good bacteria in your mouth and in your body.
And that's usually already established.
Yes.
I mean, it's really hard to change that. It's really hard to like really transplant new, a whole new bacteria.
Right.
But sometimes you can shock the pool, shock the all the kids at school, and have and like really, it's similar to transplants in the rest of your intestines. Like they are very established, and it's really hard to change that.
Yes,
antibiotics
the gut biome.
The gut biome, yeah. Antibiotics can really have a drastic effect on gut biome. So you have to. I mean, I think we are using those more carefully now. They're way overused, I think, for like a lot of joint replacement patients. Now it's gotten really, it's gotten, I think, like, man, I've heard even as small as like 3 months after surgery, which is surprising. But like for knee replacement or hip replacement, you don't have to use it for 2 years anymore.
Okay.
Amoxicillin, penicillin every time you go to the dentist.
Right.
Those are getting less and less. Now there's situations where you have like a heart valve where you might be on that for the rest of your life.
Yes.
But when you when you need an antibiotic, you want it to work.
Mm-hmm.
You know, and but the downsides for GI downsides, side effects like colitis can be dangerous with some antibiotics.
Well, I have a question about that because my husband had a knee replaced.
Mm-hmm.
So when he comes in and has any significant dental work, I think even a cleaning, you give him an antibiotic of some sort. And if he comes in for a major, let's say a crown or something, then he has to take antibiotics for a period of time before and after, so that the bacteria won't go to his knee and cause a systemic issue.
Yeah, and
so,
the reason we do that, is because of the theory or the concept that any kind of bleeding anywhere in the body, or in this case, the mouth, if you expect to have bleeding in your gums, some of the oral bacteria in the area can get upstream, can get into the blood. So now there's bacteria in your blood. Your body has a really, really great way of attacking that bacteria. But if you need a little bit of help by taking oral antibiotic, you need to have the antibiotic in your blood before you introduce that bacteria, right?
I see, yes.
Now, your husband who's taking that and thinks that he has to take that every visit for years and years and years might not need to take it anymore.
Oh, okay.
And we don't like to be the only ones making that call for patients. We would like you to check with your doctor. It's very easy to find the guidance on this.
Yes.
And it's there's going to be an academy for orthopedic surgeons that has or cardiologists that have like their own general like guidelines.
Yes.
It's very likely that patients think they need to take it for the rest of their life, and they really don't.
Well, he did have the unfortunate experience. It wasn't, after coming here, it was on a fishing trip where, and he doesn't even know how it happened, a cut or a nick. Some bacteria got into his bloodstream, and he ended up in the hospital for 3 days. They had to take that implant out, scrub it down. He had like sepsis.
So that's on his knee, right?
On his knee,
and it's just one knee?
Just one knee that he had replaced the prior year.
Okay, so a year ago, the knee... He developed sepsis on the knee from a cut, right? Yeah,
so he had the knee replacement 4 years ago now. A year and a half later, he got that little tiny cut. Bacteria got in, went right to that implant, and basically his blood tried to kill him.
Right.
So he ended up in the hospital. So that's the reason why,
we're
overly concerned about him coming into the dentist and having the...
So in that case, I would say... he might have to take that because he's demonstrated such a sensitivity to that.
Yes.
Right? So I'd be comfortable just doing the antibiotic pre-treatment every time he comes in.
Okay.
But check with your doctor because some of them are saying you don't need to do this.
Right.
But in that particular case, because he's demonstrated that episode, I would say if we're seeing it for cleanings, he's getting the pre-med. Antibiotic until we hear otherwise.
Okay.
Yes. And we're still doing that. We're not making the call, we can dispense it.
Yes, that's right. I didn't know that until his last visit because I thought he had to have a prescription from his doctor, but you can dispense that.
Well, yeah, I mean, we're going to write you a prescription, and so you'll have that, and we recommend people take it an hour before they come in. But sometimes if they forget, we have it here.
Yeah, that's great.
So I would just have them let us know immediately. Let us know as soon as they find out.
Yeah, for any implant, if you've had an implant, then there's something to think about.
Yeah, I mean,
and to tell you about.
And usually after you've had an implant surgery, like an artificial joint, they're going to have that conversation with you. Every time you go to the dentist, you just need to remember this.
Yes, right.
And we're going to ask that question too. And so. So there is a backstop. So, and we've got a stock of it here. We've got for office use. It's not a controlled substance, so we can keep some here.
Oh, I see. I see. Yeah.
Hey guys, thanks for watching the Blake Perry podcast. Please tune in next week because we're going to continue the conversation with Rebecca.